This is CommonWell TV, where we're pleased to now be joined by the newest member of the CommonWell Health Alliance family, that is the Executive Director, Paul Wilder. And Paul, maybe if you could just share some thoughts on COVID-19 and the virus as this is really starting to come to the forefront. And I know the healthcare system is really being put on a kind of a strain.
Yeah, well, first of all, of course, hopefully this is not something we have to talk about much longer. That worldwide we get past this and everybody's healthy. I'm obviously concerned about my family and everybody else's as well. So, with that said, it does really point out the importance of interoperability and making sure that we have a coordinated healthcare effort. I think we talk interoperability; it's a really big word, and you have to kind of break it down and say, what does it mean? And it's really, exchanging data between entities, between providers, and then to patients to better serve both the clinical care, administrative, and the rest. And it's really hard to take something like a COVID-19 coronavirus and predecessors before it without the context of what the clinical history of the patient is already. Read a great article today talking about, do you have an allergy? Do you have a cold? Do you have a flu? Or do you have a coronavirus? And for us to react to 7 billion people around the world, 8 billion, potentially exposing a high percentage, and this could hit 40%, we don't know, for every one of us to go to an ED, go to an emergency department every day, there's no way healthcare can support that. So we need data. We need to know things about ourselves. Our providers need to as well. So when we do call up the telehealth provider or a primary care doc, they can ask intelligent questions, and they can also give intelligent suggestions about what to do and say, hey, you have a history of allergies. At this time of year, do you normally have a runny nose and itchy eyes? It's probably allergies for now. Be calm, be vigilant, keep washing your hands. And if you see a fever start to emerge, absolutely go see someone, because that would be abnormal, but it's difficult to detect versus the flu. So I think having just a personal history plus a medical history, where you traveled and everything, is important as we do this. And as we see providers we've never seen before, having access to that prior data is even more critical than ever was before.